Well, it's time for another chat with David Ashford, the Minister for Health and Social Care. This is where we get a chance to be much more in depth, rather than obviously the limited questions we can give you, David, on the sort of daily basis. They're cutting them back even further next week. I think we're down to 3 press conferences now and a new location, but we'll see that on Monday. I want to start though with dentistry, because this is a fast-moving story of what's going to be happening here and what's seems to be allowed in the UK. So would you like to pick up on this? Because there are 2 different thoughts on this, isn't there?
So we've been working with the dentists on a standard operating procedure to put something in place to allow practices to reopen. There is a split within the dentistry community. There's some that are very keen to get an open now, and there is others that aren't quite so keen to open at this current time. What we've been doing up to now is running things through the emergency dental service. When I announced the Back to Health document as to how we would expand our services the other week, we announced that we were expanding procedures available through the emergency dentist. So things such as temporary fillings and also cementing crowns are now available via that service. But obviously what we want to do is get to the point where individual practices will be able to reopen.
But the UK, didn't they throw quite a big spanner in the works, because you were going just for emergency stuff and very limited? The UK, haven't they really said they can get up and running again almost straight away in the next couple of weeks?
They're hoping to in the UK. They've been working on processes to put in place to allow that, exactly as we have. Like I said at the start, we've been engaging with the dentists and having their involvement in drawing up a standard operating procedure that can apply across dentistry to get them open.
So a bit of a split here, is it then, or what?
So no, I think we're working towards getting dentists open, but what's important is we've got to get dentists open in a safe way, both for the dentist and their staff themselves and also the patients. And
we've touched on this in the past, that now with 0, I haven't got the figures for today, Sunday we're recording this, but if it's another 0 day, it's really could see us lifting some sort of restrictions, I presume, in all sorts of ways, can't it?
Well, as the Chief Minister announced on, I think it was Thursday's press conference, we are looking at the next phase now as to things that we will move forward with over the next 2 weeks. We have been able to move quicker than expected with the excellent results that we've had so far. But again, it's not a time for complacency, but we have to bring things back in a measured way.
And something else I'd like to bring up, this FOI over what's going on at the Comus Hotel. Again, can you give us any update? You didn't want to respond to it. You're burying this in some degree. There's going to be obviously massive implications that something has gone wrong here, and it's going to come out eventually, isn't it?
Well, it's not about burying anything, Paul, to be perfectly honest, in relation to the FOIs that have come in. As has been said, in terms of the medical advice and so on, it's used as policy formation. So it wouldn't be answered at this time. But as was made absolutely clear in the FOI response, once the emergency is over, then that is something that probably would be released, but it won't be released while policy is still being developed. That's standard across government, not just here, but in most governments around the world. Policy advice is not FOIable while it is live advice. Okay.
Now I'm going to some questions. Now feel free on this occasion to say I've already done this one, because I know they come up and people write in, and I'd like to ask their questions because they've obviously not heard the answer. But clearly, if there's no update, we'll move on. And this is one really to start with. It's about the dredging that's being allowed by key workers in Peel Harbour and also MER railway workers. Now we have, as I said, heard this a few times, and yet at the same time, you know, the gentleman who wanted to go to couldn't come over for the funeral. So this person's asking again, what's going on?
So in terms of key workers, first of all, there's very firm procedures around key workers. When they come in to do any form of job, they have to continue to self-isolate, so they go to their place of work. There's only specific tasks that they actually can undertake. They can't undertake their jobs as normal. There's specific public health advice tailored to the role they're undertaking. And when they finish that job, they must then leave and go back to isolation wherever they are staying. So they are not out and about in the community. In relation to people coming over for compassionate, we have relaxed that. We are putting plans in place which will allow people to be able to come over and attend funerals, etc., and also see relatives that are end of life. One of the important things that has actually allowed us to be in the position we are in is our border control. Now, I know that has caused upset and concern for many, but it is an absolutely vital tool that has allowed us here in the Isle of Man to be able to get back to some form of normality a lot quicker than we would have otherwise.
And you're saying this is coming into play. I haven't heard any dates yet, though. Are these changes that are coming up very soon, like this week, you'll be announcing them?
There will be announcements probably in the next week. The orders are being drawn up so that we can bring something forward in relation to compassionate entry.
And there was an indication from the Chief Minister that the airways will also be less restrictive to some degree for people coming back. Is that right?
Yes, so we're looking at ways where for repatriation of residents, the potential to be able to use flights as well as the boat. It will be very limited, of course, so it won't be people just able to book on any flight they wish. And of course, they will still need to go through the process of the Cabinet Office to get the exemption to return. That is unchanged because the borders will remain closed.
Next question. It's quite long. What is the government going to do about the group of people who have purchased or rented properties on the island where they were in the middle of relocating to become Manx residents when the borders closed? Also, could government explain Section 5C in the emergency regulations that defines who is considered to be a resident, given this is a legal document that is determining who can and who cannot come to the island? It's vague and unclear. The relocation team acknowledge this group but don't know what to advise.
Right, well, the first thing to say is anyone who actually can show that they were relocating to the island in terms of either purchasing a property or renting a property prior to the border closure can still apply to the Cabinet Office to enter the island. That is in place. So they can actually do that. There is nothing to stop people moving to the island in those circumstances. In relation to Section 5C, in terms of the resident definition within the regulations, it is deliberately got certain things that can be interpreted to allow that flexibility, because if we are too rigid, then basically there is no manoeuvrability in allowing people to enter the island, and there does need to be a certain amount of flexibility for individual cases, because everyone's case is unique.
This next one might be a few days out of date now, because it's saying when and if will the Isle of Man be achieving what Guernsey has. They've certainly got some good publicity out of it. This is because they've had no cases, well, a long time now. We're up to, and I said, subject to today's figures coming out, we're still on a very good path. Is Guernsey way ahead of the curve on this thing?
Well, obviously Guernsey's outbreak occurred before ours as well, so you've got to remember they've had a longer period. We are on a very similar trajectory to Guernsey. It is good news at the moment, but like I say, we've got to remember that COVID-19 is still there in our community. There is community transmission that we have been discovering. Yes, there hasn't been any new cases identified for a while, but that shouldn't be us using phrases that I have heard bandied around about the island being COVID-free. I'm very, very nervous about those sort of phrases, because we know that people can have COVID-19 and show absolutely no symptoms whatsoever. It is a virus. And we just need to be very careful that we don't get too lax and think this is it, it's all over.
And I should add in here that I was out the other day, well, Saturday night, passing parks, and it was full-on party sessions. I mean, and the beach yesterday in Peel, but everyone seems to be keeping into their group. So people can be responsible and have the outdoor life now again. Sort of.
Yeah, I mean, I think the Manx community has been massively responsible. To be perfectly honest, Paul, I think, it's been a real credit to everyone on the island, the way that people have reacted to this. People have been sensible about it. People have been following the rules. And it's because of that we're in such a great position. It's it's not down just to government and the actions we've taken. It's down to the actions that each and every one of our community have taken that has been able to put us in this happy position. And
you can't make it up that May was the sunniest on record, and it would have been a fantastic TT and a mad Sunday as we speak.
I think that's the law of sod, isn't it, Paul? That it was guaranteed that there was probably going to be the best weather on record.
Well, we posted things from 5 years ago exactly, and TT was shifted a week that week. But we're about to put up the stuff that we had all those gales and everything was cancelled and all sorts of hoo-has. So that just shows you, doesn't it?
It does, yeah.
Right. The collective question amongst personal trainers and gym owners: is there a date in mind to reopen the gyms? Any proposed guidelines for gyms? Now, of course, the Chief did mention this the other day about gyms, but I don't think we got a date, did we? But anyway, will there be a cap on how many members allowed in at once, as some gyms can cater for more members than others, given they have larger floor spaces?
But the simple answer is, Paul, at the moment it's up in the air because the guidelines around gyms are currently being looked at. As the Chief Minister said in Thursday's press briefing, we are looking at what we can do to get indoor sports and gyms up and running. He did actually put a date on it and said, assuming things continue to go well, we would look to be no later than the 15th of June. So it wasn't a specific date, but it was no later than the 15th of June for them to be able to reopen. There will be regulations around how many people can be in. There is, of course, regulations currently in place for those using outside around equipment and the cleaning of equipment, and I would expect those regulations to form part of it. But the guidance is in the process of being drawn up as we speak, so there isn't at the moment any firm guidance there that I can refer people to. Okay. But our ambition is to get gyms and indoor sports up and running by the 15th of June. And
personally speaking, my waist requires the gyms to open. Thank you. If you can arrange that. Should Tynwald Day go ahead? I kind of alluded to that on the other day myself as well, because it's looking so promising, and you just also said people are being responsible. You're not encouraging people. In fact, the press aren't even encouraged, besides the official radio and TV pictures. We've so far, and I'm contesting this, that the press are being told we can't turn up. It's outrageous, isn't it?
Well, I hadn't heard that one about the press. Obviously, I think it's sensible not to have the fair, not to have all the usual stalls, and to be encouraging mass gatherings. July is still a few weeks away. Yes, things are in a good position at the moment, but no one can predict the future. The thing with Tynwald Day, though, because I've seen quite a lot of comments on social media about why not cancel it altogether, is Tynwald Day isn't just marking the national day. It actually has a legal function, which is the proclamation of the acts. If acts of Tynwald are not proclamated within 12 months, then basically they fall. So the laws that have been passed would actually fall away. So we do have to go through the Tynwald ceremony in order to do that.
So you'll be there on the hill, you'll be briefed and given your social distancing?
Yeah, so there'll be social distancing basically in play.
Do you think it'll be 1 metre by then, David, or still 2?
So, sorry, what was that for?
Do you think it'd be 1 metre by then, or 2 still? You're sticking on the 2?
We'll wait and see what comes out.
Right.
Things are in a good place, so rules can change.
Could you ask when community adult therapy services will start again? I'm waiting to be seen. Now, this came in a few days ago, so that may have changed as well, has it?
So we are moving forward with the community adult therapy service to get them up and running. Again, obviously, anything that's face-to-face is more difficult to turn back on because we have to ensure that there's social distancing employed and various other things. So, there is a lot of work going on, but certainly around all of that, we're hoping to be able to make announcements in the next set of announcements I make in relation to health.
You're making some big announcements this week?
Sorry, Paul?
Are you making big announcements this week then?
I'm hoping this week to be able to announce the companion document to the Back to Health. If you remember when I did the press conference, I said there would be a companion document around back to care for the social care aspect and the adult care services within the department, and I'm hoping to be able to do a piece around that document later this week.
Good. One thing wasn't clear from the press conference, I don't know which day they're referring to, was when will restaurants and cafes be allowed to open indoors? They mentioned bars, pubs and nightclubs. Not sure if this clarifies what's going on exactly. So obviously outdoors they were talking about it being possible, but indoors.
So again, in relation to restaurants, there's works going on around that to actually allow restaurants to be able to open indoors. Again, there will need to be social distancing employed, and that is one of the things that comes into the debate around the 2 metre and 1 metre, because that can have a massive difference between whether it's viable for a restaurant to open or not. So that is guidance is going on, and we should be able to make announcements around that shortly. Pubs and nightclubs is a bit more difficult because it's not always easy and practical to employ social distancing in those environments, and that's why in relation to pubs and clubs we've actually said it's more likely to be the end of June, start of July before we're in that space to make those announcements. And
any secondary thing about outdoors was that I can't remember, maybe you said this, I mean, can any restaurants without side space get underway yet a while, or was it still a date?
So as long as they hold the appropriate licences to be able to have outside space, and their outside space employs social distancing, then yes, they can start to operate.
You know it's going to rain after all this, don't you?
Yeah, we'll probably have a typhoon, Paul.
Yeah. Government are opening the schools on a phased basis. Parents are receiving letters from schools saying they would prefer it if they didn't return. Is that right? And if they did, they shouldn't be taught by a teacher. Instead, they'll be, as at home, logged into Google Classroom and doing set pieces of work. Still no interaction with teachers teaching them. And schools, how would they do with a space being too little movement? Therefore, wouldn't they be better at home? Does that make sense? It's a bit more as well.
It's sort of. I think there's a multitude of things in there. I'm not aware of letters going out saying children shouldn't return to school.
No, that's why I was puzzled.
What we have actually said is that it is the parents' choice. So we're not going to compel someone to send their children to school. If they feel more comfortable continuing to have them at home, that is absolutely fine. We are happy for that for the remainder of the school year, and then we'll reassess ahead of the new school year in September. The schools will have to come back on a phased basis with certain years in order to allow social distancing to be set up, particularly in the classroom. But one of the things I've always been quite clear about is that I fully acknowledge with children it's exceptionally hard to try and do social distancing, and you can't really do that. And that's why the Minister for Education has been talking more about children keeping to a bubble. So children in school interact with the other people in their class and not necessarily the wider school population. But it does need to be on a phased basis. And if parents do not feel comfortable at this time, if their children are in the particular year groups going back, then they do not have to send them. They can keep them at home. It is their choice.
And more on the schools. Why aren't the teachers in school? Surely the schools are open. They should be there to teach the children, and they are not teaching children via Zoom. Give each child access to an iPad. Should they not have access to one themselves? And that would sort it, I think that's what they say.
Right, so in relation to teachers, a lot of teachers are in the schools and are teaching. As we know, we've never shut the schools because we've had the hub system in operation, but we've also got to remember there is teachers who are in the vulnerable category. Teachers that are shielding as well, and so at this current time it's not appropriate for them to be within the school environment. I know from personal experience that children are getting homework sent to them, particularly around secondary school where there is online learning being done, so the teachers are engaging and they are actually drawing up work for pupils.
And one more, dinner time at the moment in some of the hub schools are continuing to accommodate children on a 1.5 metre dinner table at lunchtimes and 3 children to a table, obviously not the 2 metres apart. How is this going to improve when more children start going back to school?
Well, that again is one of the practicalities that will need to be worked out by the various schools, and one of the reasons they've got to return on a phased basis. So it's not going to be simply a case of all the schools are going to be back up operating at 100%. They will have to bring back year by year, and the Department of Education has looked at which year groups would benefit most from being back at school, and that's the basis it will come in on. And as I've just said, we've got to accept that social distancing when it comes to children is exceptionally hard to do. So it's more important about having that bubble within the school where the children are interacting with the same children day in, day out, rather than the wider school population.
Here's a question we ask, but it's always worth repeating because things can change. And what about mass sampling of the Manx public to determine how many people may have already had the virus and could at least have reprieve from the fear and anxiety of becoming infected?
So in terms of antibody testing, I'll be able to make some announcements very shortly around that, around a programme for antibody testing, because we do now have a validated antibody test, and we will have access to that. So again, hopefully over the next week I'll be able to make announcements. But the one thing we've got to remember is while that gives us data on how prevalent COVID-19 potentially has been in our community, it should be remembered that just because you've had it and you have the antibodies does not make you automatically immune.
The UK could potentially be opening some borders for holidays. I think it's referring to air bridges. And what will happen if the Isle of Man borders are still closed, as there's likely to be a massive problem with insurance not being covered, in other words. And I see what they're saying, because you can cancel holidays if you can't get to them, but if it's just an Isle of Man technicality, there's a lot of insurance companies will have no Isle of Man part on that, and they could lose the whole holiday, right?
Well, again, that would be a matter for the people to take up with the individual insurance and travel firms, because I know from certain issues I've dealt with for people, different firms and different holidays have different terms and conditions attached. I know there's some that have actually had a full refund that I've dealt with because if the Isle of Man border's being shut, so they say they can't physically go on it, because even if though they can leave the island, they can't technically get back. But we are looking at air bridges as well. I think we mentioned that a couple of weeks ago about the potential for air bridges, but we just need to be exceptionally careful. Like I say, the border controls that we've had in place has been one of the greatest things suppressing this virus in our community. So if the UK is in a good place, if other countries are in a good place, that's the time when we'll be able to look to relax. But we are not going to relax it simply to accommodate the holiday sector. We have to do what's medically right for our island.
Now you push on those air bridges thing. I don't remember hearing that, but we're talking about the UK as an air bridge.
So if you remember, that it was brought up at one of the press conferences, Paul, around the idea of potentially having air bridges. The Chief Minister mentioned it in answer to a question, I think from one of your colleagues, in relation to air bridges. And we said, if you remember, that one of the things we might look to is if Ireland was in a much better position than the UK, potentially an air bridge to Ireland or further afield. But the thing that we've got to remember with air bridges is they're two-way streets. It's not just people going out, it's people coming in as well. So we need to be exceptionally cautious around that and make sure that any movement in that area is done in an appropriate manner.
I mean, obviously, without direct holidays to Spain, it's got to be UK for most people who need to get there for their holidays. You know, the ones that are booked on. You're not saying that at this stage at all. Just potentially Ireland as one of the ideas.
Well, that was one of the things we said at the time. Obviously, in terms of border control, as I've said, it's not just about the situation on Ireland, it's about the situation in our near neighbours too. And so we will have to look at where the UK is at any time. But, you know, I don't want people getting excitable and suddenly thinking all the summer holidays will be able to go ahead as normal because, you know, we're going to have all these air bridges in place. At the moment, it's just conversations that are going on. There is nothing at the moment cast iron and guaranteed. And like I say, from my personal point of view, the border controls that we've had in place have been one of the greatest weapons against COVID-19.
And I had a conversation with somebody the other day, and it was almost like they were just saying, "Oh, I've booked an EasyJet on the 15th." I think is when they started their showing flights, and you know he's coming over on the 15th of Isle of Man. And I'd say, I don't think so. But they've taken the money and everything, and there's no warning or health guide to say there may be an issue with that. Is that something that needs to be looked at?
Well, I know there's been conversations with EasyJet, but in relation to the borders, people cannot enter unless they meet the criteria to do so. People would need to be carrying an exemption certificate from the Cabinet Office in order to enter the island. If people are not, do not carry that appropriate exemption, they will not be allowed to board and enter. So
you're having a conversation with EasyJet, 'cause last time you said that's the easiest answer. No, we're not. So things have moved on. You are now in communication. You're discussing things. A plan of action is there, potentially there?
In the same way we speak to all operators, Paul. So, for instance, we've had Loganair continuing to operate throughout this entire situation. So it's just the day-to-day ordinary conversations we have with operators.
Okay. This is a bit of background and quite a few questions off it. So a considerable number of people, myself included, who should have been on the shield or vulnerable list, but because they either have a relatively uncommon problem or do not attend Nobles, have not been contacted and not over 70. The UK allowed GPs to add names, we did not. The UK allowed self-nomination to be then confirmed by the GP, we did not. Question 1, why was the list of conditions more limited than the UK? Shall I do one at a time? Should you do that first?
Yeah, we'll do a piece at a time. Yeah. In relation to that, as far as I'm aware, GPs were able to highlight people who required shielding. I've certainly not seen any evidence that they weren't. As far as I'm aware, the GP community was engaged in relation to that. Obviously, we can only advise on the people we know about. The conditions that were looked at were those that were most vulnerable should they contract COVID-19. There are people shielding who are not over 70. So it's not a case of only the over 70s were written to. I'm aware personally of people who were written to who aren't much older than me because they have certain conditions that would actually make them exceptionally vulnerable. In relation to advice for those shielding, there is new advice currently being drawn up, and people should be being written to in the next week or so. But the crucial thing with anything like self-isolation or shielding is it is down to personal choice. So people have got to make the decision of what's right for them. If someone feels vulnerable, if they feel they're not at the right point to be going out into the community or doing things differently, and they want to continue self-isolating, then that's perfectly okay. People have to be, people have to judge whether they feel safe and secure at this time.
Why are some of the UK lists who are chronic neurological disorders not initially included on our lists?
In terms of neurological disorders, like I say, we make our own assessments on who we believe is vulnerable, who we believe requires to shield, and the categories we picked were the ones that we believe, if they contract COVID-19, are in the most vulnerable state and it would have the most effect on them.
And you might have dealt with these already then, so why not allow self-nomination, and will you undertake to update the list and write to those currently left unsure how they are feeling to this situation?
Well, in relation to those who are feeling unsure, like I say, we can only write to the people we are aware of. So we can't, we haven't got a magic crystal ball to be able to know of people that we are not aware of. We are going to write back out to those who are already in receipt of a letter. But like I say, the key thing now, as government returns more responsibility to the individuals, is to be saying to people, you do need to make your own choices as well. You're aware of what conditions you have. You will have seen from the news what impact you think COVID-19 would have on yourself if you caught it. For people who want to continue shielding or want to continue self-isolating, it's a personal choice for them to do so, and it's perfectly okay for them to make that choice. It's about what people feel comfortable with in their own lives.
Okay. Before we go, we still had a couple of people in hospital getting over the virus or whatever being dealt with. When they've dropped off the list, and they're clear, are we then saying we're clear?
Right, so the hospital currently doesn't have any COVID positive patients.
Oh, we're clear there, right. Okay.
In terms of the hospital, so there's 3 active cases as of yesterday, but they're all community cases. I think the last 2 in the hospital became COVID clear. I think on Thursday I was able to announce that there was no COVID.
Okay, well, when these 3 become clear, what do we change our status?
Right, so at that point, the status is we have no active cases. As I said at the start of the questions here, Paul, I've heard the phrase bandied around, and I know some jurisdictions have already started using it, of COVID-free. I worry very much around that phrase because this is a virus. There is lots of people who get it in very mild cases. In fact, the World Health Organization's latest figures, I think, say 84% of worldwide cases are mild. So in other words, people who may feel they've got a cold or something like that and just shrug it off, but it's actually COVID-19. So when it comes to a virus, until there is a vaccine, I'd be very, very careful about bandying around any phrases around being COVID-free. Well,
we could be here for many more weeks chatting, and thanks to everyone who sent those questions in. And thank you, David, for your time as well, because I think it is quite good to get that longer chit-chat about things like this. And even if we do answer questions maybe more than once, or ask you questions more than once, things do change, and it's always worth having an update. So you're pessimistic, I think, by nature, you always say. How are you feeling
cautious
today?
Paul, I wouldn't say pessimistic.
Oh, yeah, okay, cautious, yeah, I'll give you that.
Things aren't quite that bad.
No, you're right, but you're always careful.
Yeah, the glass is half full, not cracked in the bottom. But no, I'm very, very cautious by nature, and I think I would hope people would expect that from a Minister for Health and Social Care. I'm always cautious with things like this, but I'm always happy to do these sessions, Paul, and hopefully be able to answer some questions.